So it's an urgent time, and once this thing is implemented, it's going to be hard to unravel. So October 1st, they start actual registration. January 1st, it's done. And even though the president has given special favors to Congress and federal employees, unions, big business, delays, the average American is going to be stuck with it. So we are going around the country because it's important and it's urgent. We also think it's winnable in a political sense, that we know that over half of Americans want this thing stopped. And when you add in major fixes, you get up to about 75%. Is to fund the government in its entirety, to pass a bill with a lot of debate and talk and news, press releases, that we're funding the government. But this funding does not include Obamacare. For obvious reasons, it's not ready to be implemented. Over 50% of the deadlines have been missed. And if they pass that and tell the American people, we're funding the government, we don't want it to shut down, the president's the only one talking about this, then it's really in the president's hands. Does he want to slow the government down, which is in fact what it is, in order to save his law that he's already said is not ready for being implemented, or at least he's delayed parts of it.
Do you know how much, if President Obama did not fund, how much money are we talking about in the budget that needs to be, keep the economy going, basically? How much is that?
I'm not sure how much it is. Do you know?
Yeah, it's
like a year or two. How much?
It's $48 billion in subsidies will be paid out in the first fiscal year alone, and that's mandatory spending. And then there would be more spending on the entitlements.
The administration of the program.
Correct. I mean, the administration, I think, asked for $1.5 billion for HHS funding for implementation. They asked for something like $440 million and 2,000 employees for the IRS for implementation.
How can the president actually not implement portions of it just himself, by himself saying that? Is that legal?
It's not legal. Our legal scholars have said this is clearly a violation of our rule of law system to have a law in place and to arbitrarily enforce it on you but not you, and to enforce it on individuals but not employers, to give Congress a waiver where it specifically says they don't have it. That's an argument that has to be made in a court, and it's not going to be done over the next few months. But the president is not following the law himself, so he can't make a case, this is the law, we need to go ahead with it.
Is there a lawsuit being drafted?
I'm not sure about that, but part of the way that the constitutional separation of powers is preserved is by Congress standing up for its rights. And so Congress has the power of the purse, and if Congress wants to protest what the president has done, they can do that by refusing to fund the law.
And not funding particular laws or government activities is not unprecedented at all. It happens every year. We pass an appropriation bill. And all of us, and me included, have offered amendments on appropriation bill that says no funds shall be used for probably Planned Parenthood or public broadcasting. I've done that. And if you can pass an amendment like that, then there's no funding that can be used in the federal budget for that program. And we wouldn't expect Harry Reid to necessarily take it up. But if the House passed it and sent it to the Senate, it would give Republicans something to talk about that needs to be done, where the majority of Americans would be on their side.
Heritage a couple of weeks ago warned us about that Congress was going to try to get on the waiver for Obamacare, and now we find out that they have got the waiver. Again, the question is, are they acting against the law? Do they have any authority to get that waiver from Obamacare?
There is no authority to do it. And they're administratively deciding that Congress will not abide by the law. And what Congress is afraid of is they will go into the exchange, but the law does not allow you to take the employer portion of your health insurance into an exchange. What that would mean is that congressmen who make $170,000 a year would not be able to use a subsidy of like $8,000 a year in the exchanges. So individual congressmen and senators would be be paying, I don't know, somewhere between 6,000 and 8,000 more. Is that in the ballpark?
Yeah, it's about 5,000 for an individual and then 10,000 for a family plan generally.
Yeah, so it is a big waiver, and there may be some wealthy congressmen or senators who say they're not going to take it or whatever, but there are a lot of guys like myself that, you know, that would be very difficult to throw that kind of thing on top of you. But I understand this came after the president met with some of the Democrats there. I can't necessarily verify that, and they were asked to get out from under it. So, but it clearly violates the law.
What do you tell them?
Well, the key word there is afraid. And I frankly, I have very little patience for that when every Republican ran on the promise that they would do everything they could to stop this bill. And Republicans were given the majority in the House in 2010 with the promise they were going to do everything they could to stop the bill. So to say that I'm afraid about my next election to keep my promise is something Americans are growing increasingly impatient with. So I just think it's just time for them to step up. If this is not what worth fighting for, then I don't know what is. And I frankly think if they took the case to the American people as we're doing, they would see what we're seeing is if people are ready to stand with you, if you'll stand up.
To get to wasn't the individual mandate for health insurance at one point an idea generated by heritage scholars or heritage researchers?
So you want me to take it?
Well, yeah, I think, yeah, you've been around.
I've been around in Heritage for 10 years. I run Heritage Action. In 1989, the Heritage Foundation wrote a paper that supported the individual mandate. Over time, we've learned especially from behavioral economics, that there's other ways to achieve what we tried to achieve. We've been opposed to the individual mandate since 1995. Ironically, President Obama actually has had the opposite learning in his primary, if you remember, against Hillary. The one criticism he had of Hillary Clinton's health care plan was she had an individual mandate. He said it's not fair to make somebody buy something they can't afford. Unfortunately, he had the opposite educational experience that we've had, and now is in favor of an individual mandate that he rightly opposed back in 2007.
We just saw today that UPS announced that they were going to, for 15,000 employees and spouses, not offer their health care. So as we perhaps start seeing more and more of that between now and the end of September, and apparently there's been no comment out of the administration for that number of people that obviously are not going to be able to keep their existing health care.
Yeah, well, they like, if I worked for UPS, I would have UPS insurance, but my wife and children would have to go on the exchanges and get a different policy. So that's what a lot of employers are going to say is if you have an alternative, you don't get our coverage. And that's already the policy in a number of employers. But if you don't have an alternative, you're covered by UPS. But now Obamacare creates an alternative for everyone. So a lot of employers can drop insurance entirely. You're going to see that with a lot of small companies, and a lot of people under 50 are going to just drop it completely, and those above 50 will probably pay the fine and drop it.
Who exactly are you guys trying to appeal to? And in that, are you maybe even thinking outside the box, maybe going away from your core constituency?
So we're trying to reach out to all Americans. I think that, as important nowadays as conservative and liberal and some of those divides is the divide between those who are inside Washington and those who are outside. And I think that what we've observed at Heritage Action for the last 3.5 years since we've existed and on this tour is there's a whole bunch of people who don't feel heard in Washington, D.C. They have a whole bunch of politicians who listen to lobbyists, they have a whole bunch of politicians who listen to political consultants, but they don't feel like anybody's standing up for themselves. And so we're trying to reach out to anybody who feels unheard, anybody who wants to have a voice in Washington, D.C., and the majority of the American people who have deep concerns with Obamacare for all the reasons that we've been talking about.
Well, Obamacare is uniting people across the political spectrum right now, and you're even seeing some very liberal supporters of Obama coming into this, let's stop this thing, as they understand it's going to affect their life. And that the promises the president made are just not coming true. The idea you keep the insurance you had, there are a number of people, particularly young folks who had high deductible policies, can't keep them without paying a fine. And so by this time, the president said the cost of policies would have dropped $2,500 a year. They had actually gone up over $2,000, so that's a big spread. So I think we're seeing more and more people come together around this idea. And what we're trying to do is just unite more people behind it, not that they're Republican or Democrat, but just around the idea that in America, we really should be free to make our own choices. And there are a lot of ways we can make health care more available than going to socialized medicine.
The fact that, I see what you're wanting to fund Obamacare now, but what do you think of the House's 40 votes to repeal it? I mean, that is obviously politically going nowhere. I see what you're trying to do with this thing because you've got a legitimate aspect, but I mean, what do you think of that? Is that good for you, your campaign here for the House to do that? Because it's mocked in many circles as like going nowhere.
Well, I think the House has taken a lot of votes, many of which were show votes, many of which were ways to come home and tell your constituents I voted to repeal Obamacare. There is exactly one live fire drill right now to stop Obamacare, and that's defund. And so the question we're asking every member of Congress, Democrat and Republican, is, are you in favor of defunding Obamacare, or are you not? And if you've told your constituents that the reason to send you to Washington is to stop Obamacare, why are you sitting out the only live fire drill that's going on in Washington? That's why we're not calling for a government shutdown. We're calling for a CR to be passed that funds the government but doesn't fund Obamacare. Ironically, many of the people who say we can't have a shutdown and scaremonger over Social Security and Medicare, the falseness of that claim is proven by the claim that a shutdown wouldn't stop Obamacare. Namely, if a shutdown won't stop Obamacare because it's mandatory spending, then the mandatory spending in Social Security and Medicare will also go out. And so there's one person in Washington, D.C. who's talking about a shutdown, that's President Obama. We're in favor of funding the government and defunding Obamacare.
What alternative is there?
Let me answer the question, though, directly. You can add a rider to any appropriation bill that disallows funds, whether it be mandatory or anything. And so, Congressional Research Office has confirmed that Obamacare has to be funded through annual appropriations, and we regularly attach riders that say no funds shall be used for this. And it would be very easy for the House of Representatives to fund the government and say no funds shall be allowed for the Affordable Health Care Act or whatever they call it. They call it Obamacare, I guess. And so this is something that is completely false, that you can't stop mandatory spending. You can't.
Every year since 1976, Congress has passed the Hyde Amendment, which defunds abortions in the Medicaid entitlement.
You're saying that you're not advocating shutting down the government if Obamacare can't be defunded. Senator Rubio, we are all interested in him, has said the government should be shut down if necessary to defund Obamacare. So you disagree with Senator Rubio on that? Or?
No, the House should pass an appropriations bill that funds the government and does not fund Obamacare.
And
they should never pass an appropriations bill in September that funds Obamacare. And if that leads to the president shutting down the government, then they should not blink. The key here, as Senator Cruz said yesterday at our event, when you go into a fight like this, the first person to blink loses. And so it's very easy. If you want to stop Obamacare, don't blink.
So it's not incorrect to say that you would prefer to see a government shutdown over continued funding for Obamacare?
Yeah, we think that nothing should be done in the month of September or beyond that to fund Obamacare.
A government shutdown is, first of all, it's a misnomer. It's a slowdown. Essential services continue to get funded. Most Americans wouldn't even notice the government shut down. And the damage that could be done from a slowdown is so much less than the damage that's going to be done from implementing this bill. Yeah, it's worth the risk that the president might do it, but if the government is shut down, it will be because he decides to do it.
Thank you all very much.
Yeah, thanks, everybody.